I'm Jenna.
And I'm Tina.
And we are registered respiratory therapists with Poplar Pulmonary Wellness. And today we're going to be exploring the connection between our mind, our body, and our soul. And we thought, what better topic than to talk about mental health?
Mental health is huge. It's so important. And I find when I talk to people living with chronic lung conditions that when they were diagnosed, nobody mentioned to them that there is this mental health aspect to living with a chronic condition. It can happen with any chronic condition, and it most certainly happens with chronic lung conditions.
And the two mental health issues that are most prevalent when you're living with a chronic lung condition is anxiety and depression. And with both of these things, we may feel symptoms of anxiety or symptoms of depression off and on. And that can be normal, peaks and valleys, ups and downs. But
that's life.
That's life.
Yeah.
Yeah, absolutely. But we're really talking about when these symptoms persist and really start to negatively impact our life.
Yes, and it can be quite an impact too. People are suffering, they're isolated and suffering, and so we want to reach out, we want to let you know what to look for and what to do.
So first, let's start with anxiety. And when we talk of symptoms related to anxiety, we're talking about things like worrying about things that haven't yet happened. You may also be feeling symptoms of irritation, agitated, fidgety, difficulty concentrating.
Yeah.
Yeah, and really just that overall feeling of having trouble relaxing.
Yeah, it's there. The mind is going.
The mind is going. For depression, we're really looking at symptoms of things that go along with feeling that loss of interest in doing things. Maybe activities that you used to really enjoy, and that passion or that interest isn't there anymore.
Yeah, if you find that that's waned on an ongoing basis, then that's your tip to look into it. And one thing as healthcare providers, we have tools, there are screening tools available to identify anxiety and depression. And so these screening tools we use at Poplar are the GAD-7, which is an anxiety screening questionnaire, and the PHQ-9, which is a depression screening questionnaire. And both of these are short, they're simple, they ask very basic questions that anyone can answer about themselves, and they're used to screen. So it's used to not a formal diagnosis, but it can highlight that there could be a problem here and that maybe professional mental health is needed. And so they're very simple, quick questionnaires that we use, and it's a great way to introduce the topic, and it makes people reflect on putting all of those pieces together to realize themselves, hey, I think I am having some mental health issues, so that you can start to identify that and find a way to fix it early.
Absolutely. And so that leads to some treatment. So if we have screened for anxiety and depression, to be diagnosed with it, you do kind of have to go on and see a healthcare provider, get a detailed history and questionnaires done, and have a psychological evaluation, which can be a bit of a scary term, but we get evaluated with our body all the time. We get our blood pressure checked, we get breathing tests done. Why wouldn't we get evaluated for our mental health? It's so important to our overall health and well-being.
Yeah, prioritize your mental health, and after all, it's just a conversation. There's no need to be afraid, right?
So when we think of then non-pharmacological treatment options to help us when we're experiencing anxiety and depression, our first one is to seek help. Whether you need that help urgently or non-urgently, there are a lot of resources either locally, here in Canada, provincially, nationally, to get you connected to the help that you need. And so take a look in the resources below. We've provided some links for that.
Yeah. Awesome. The other thing you can do is self-care. And self-care is something that you can do. You can start right away. It's things like some breathing techniques, meditation, or exercise really helps. Socially, connecting with others as well, to talk through things and just have that connection with other people. And the more of those things that you are able to do for yourself, the better, holistically speaking, you can work towards being in a better mental state.
Absolutely. And when you think of something like self-care, it doesn't have to be overwhelming. Start with your basics. Are you getting enough sleep? Do you have enough good nutrition in your diet? Are you moving? And you mentioned exercise. So start really basically to make sure you're hitting the needs that your body requires. When you live with a chronic lung condition, mental health is so important, and anxiety and depression play a big role.
Certainly do. Learn what to look for, learn the signs and symptoms of anxiety and depression, and then seek professional mental health guidance if you need it.
So here at Poplar, we have lots of ways to support you. We provide one-to-one sessions in our Poplar clinic with a respiratory therapist. We have group support sessions, and our Poplar online community is waiting to meet you. We've got a lot of resources in there, a way to connect with us as well as each other, so do check it out.
Check it out, reach out so that we can help you to get out there
and live your best lung life.